This episode is brought to you by the University of the Pacific's Diabetes Essentials Certificate Programs.
Welcome to Social Work Talks. I am Greg Wright. The nation is grappling with an opioid addiction crisis, but what many may not know is that the problem may be greater in the LGBTQ community. According to the Centers for Disease Control and Prevention, people who are LGBTQ have higher rates of substance abuse and are more likely to be heavy drinkers into later life. To learn more about why this is so and how social workers can help, we are talking to two social workers from the San Francisco AIDS Foundation who are on the front lines of the addiction crisis. They are Rio Bauce and Kyle Temple. Welcome to Social Work Talks, guys. How are you? Fine, I hope.
Great.
Kind of quiet there.
Yes, I'm doing great.
Okay, great. Well, I'm like hoping that all of the gas prices there aren't too high, because here they're up to around $4 but I heard out there where you are it's a whole lot worse. So
yeah, we're at about $6 plus, but we're always ahead of the rest of the country.
Yeah, always.
Yeah. So
let's just jump into this. I'm wondering, how did you actually get into social work and then end up in a substance abuse area of it?
Sure. Yeah. So for me, this is actually a second career. I worked in the corporate for-profit world for about 25 years and was in a variety of industries. But I just found myself when I turned 40-ish, realizing that my professional life was not in alignment with my personal values and what I wanted to do professionally. I was working with a therapist at the time as for my own therapy, and kind of doing an inventory of what I wanted to do, what I saw myself doing, and it was at that point that I was like, I love talking to people, and I love learning, and I love exploring, and that was kind of how I decided that I wanted to go into. Yeah, I went to school, and in that, I really connected. I identify as gay, and really connected with the idea that the LGBTQ community broadly is underserved and really needs folks with lived experience to be able to come in and do the work in a way that I call it shorthand, to be able to connect with folks with a similar lived experience and be able to do so in shorthand so that they don't have to teach me as much about their experience, because we have a shared identity. And in that process, I had envisioned myself in a private practice somewhere, working with individuals, and I just realized the need for community behavioral health support. I'm also HIV positive. I've been living with HIV for 21 years and have been really interested in working in the HIV community. And San Francisco AIDS Foundation, of course, is an HIV organization. And if you dig a little deeper into HIV prevention and treatment, you realize that there's a huge overlap and intersection with substance use and alcohol use. And it just made sense for me in that way to get involved in the work that I'm currently doing. And I should say I'm a licensed clinical social worker, but I am the senior director for the Stonewall Project, which is San Francisco AIDS Foundation substance use treatment program. We use a harm reduction approach, and we can get into that later. But what we do is we work with folks on an individual and group basis, providing support around substance use and alcohol use.
Yeah, thank you.
And I love it, I should
Great.
say.
Gio, you are a intern there. So could you like tell us what your role is at the foundation?
Yeah, so my name is Rio Bauce. I'm a clinical intern at the Stonewall Project, and a lot of a lot of the work that interns we do, is through providing support to some of the clients at the Stonewall Project. We provide individual and group counseling, and ultimately, we are kind of part of the building blocks of the foundation. And there's a you know, one of the things I really like about the Stonewall Project is, one of the directors, his job is dedicated to training new cohorts of interns that are going out in the world. And I think that, being in this field for a relatively short amount of time, that a lot of the skills that I've developed in the last 7 or 8 months at the Stonewall Project are the kind of skills that we need in behavioral health and community mental health, because there is a really large need. If you walk around San Francisco, even outside of our offices, you can see that there are people that are in need of substance use services, of people that could benefit from coming here and seeing us. And as Kyle kind of mentioned earlier, one of the things that we practice at Stonewall is harm reduction and meeting people where they're at. And I think that the when you ask like the role of the intern, I think a lot of what we do is to educate ourselves on the different substances that are used in the LGBT community, and then also ways in which we can empower our clients to make changes that work toward their goals and ultimately allow them to live healthy and fulfilling lives. And so I think that there's still a lot of work to be done, but I think we have a lot of great organizations like the San Francisco AIDS Foundation and many others in San Francisco that really help toward making this the city a better place to live for more people, and also just allows a lot of members of our community who are typically underserved to receive services that they really need.
Yeah, so there is data out there that like says like people who are LGBTQ are more prone to have a substance abuse issue or an alcoholism issue. And I was wondering what are the like factors that actually cause that, Kyle?
In our program and with our approach, we like to say people use drugs for reasons, um, which is contrary maybe to some of the thinking that's out there around some sort of moral failing or even a medical approach to substance use and issues related to substance use. The way that we think about it, again, is that people are using drugs for reasons, and those reasons can be, histories of complex trauma, social isolation. Um, you know, I, I've worked with clients who have, you know, uh, who have pointed to methamphetamine use as a way to make sure that their things aren't stolen as they're living outside and trying to stay up all night to make sure that that they still have their possessions when they wake up in the morning. Meth is another, is a way to push off hunger as well. And so we see folks that are using for a variety of reasons. And if you think about, if you think about the way that LGBTQ folks are marginalized within our culture and within our society, it's really easy to understand how folks might turn to coping mechanisms that, by the way, many people use, and most people do not use in a way that inhibits their quality of life to a significant degree. But again, if you're thinking about the ways that LGBT folks are marginalized, and set aside and don't have access to quality care in many instances, you start to understand that drug use makes a lot of sense in certain ways. There's also a social component and a historical component where members of the queer community were only allowed to congregate in kind of back alley areas of various cities and such, where they couldn't be seen and were kind of tucked away. And often that was in a bar. And so, if you consider that bars are the site of community congregation and often organization and connection with other community members, you're placed in the locus of alcohol and other substance use by virtue of that alone.
Yeah, absolutely. So, but I've oftentimes have read that as far as a methamphetamine, that it's a social drug and it's also like a sex drug. So it's interesting that you are telling us that it actually there are other reasons besides that why folks use it. So
Absolutely.
that's a new one. Like tell us more, both of you, about the Stonewall like project and like how it actually reaches the folks out there and who funds it and how did you end up there? Geo first, since you're the intern. I'm gonna let you answer that first.
Oh, really? I feel like Kyle will have a better answer on this. But, I mean, um, I could take a stab at it, but Kyle will be able to fill in the gaps. I mean, we a lot of our I know like a lot of our funding at Stonewall in particular. I mean, we receive funding from a variety of sources, but a large chunk comes from the Department of Public Health, Community Behavioral Health Services, um, and then we also get some from other programs like the Center of Excellence, where we serve HIV positive patients from Ward 86, and then another part of funding which is for what we call HIV prevention. Um, and I think like a lot of our clients are, I think, are self-referred, who when they see, oh, I'd like some help with a particular substance, they might come to us, or hear from a community partner as well. I mean, I think that a lot of our, I mean, my limited experience with my clients, I think that like a lot of people try abstinent-based programs, or they might be in residential treatment centers. And for some people, those places provide really excellent care and can be the perfect, antidote to whatever they're experiencing. But a lot of our clients have also, the clients that I've worked with, have reported like, oh, this abstinent-based program didn't really work for me, and if it doesn't work for me, I'm not really allowed to participate. And so I think that's where Stonewall kind of comes in, because we don't require people to do something that is not what they're coming in and wanting to do. The motto "meet people where they're at" isn't just a motto. It's really like how we approach our clients is, the very first questions we ask them are, what do they want to do? Why are they here? And I think that really promotes a lot of success, because as we form our treatment goals and the clients see our counselors, they're not feeling like we're pushing them to do something that they don't want to do. In fact, we're collaborating with them to do something that they want to do. And I think that just in my time here so far, that just seems to work a lot better than I think a program that, if a certain person comes into a program and doesn't have the same goals as the program, I mean, that really, we miss a lot of people that could really benefit from services. And I think, in the context of like, working with a marginalized community that's so used to being turned away from services, and then you also work with vulnerable populations or people who, may be at risk of homelessness, or people who have fewer resources. I mean, they're so used to being turned away from services that I think a lot of clients, when they come to Stonewall, it may be the first time that they've ever received services that someone's not telling them what they need to do in order to be there. And I think that's really powerful.
Yeah. Earlier, Kyle had like mentioned a harm reduction approach. Am I right, Kyle? Is like that's the actual like term that you
Yes.
had used. I've heard it's like quite a controversial one. Like there are social workers who are like supportive of it, and then others who aren't. So if you could like explain it a bit better to our listeners, I would much appreciate that, Kyle. Thank you.
Sure. I call this an elevator pitch for harm reduction because it's actually quite complex, right? But the basic idea of it is that we're not interested in whether or not somebody is using drugs. What we're interested in is whether or not it's causing them harm, and harm as defined by the client, right? And so we look at the harm that substance use or other issues that the client is experiencing is having on their quality of life. And then we come alongside them to figure out ways to reduce harm. You're thinking if you're talking about like an HIV specific context, which of course San Francisco AIDS Foundation, our mission is about eradicating HIV. So what does drugs have to do with that? Well, drug use, there's a very robust overlap between drug use and HIV transmission. And part of that is because of again, putting us back in bars where alcohol is used the way other people use alcohol as a social lubricant, reducing, barriers to engaging with other people. There is definitely a strong sex link with meth for LGBTQ folks. And when we're thinking about, obviously, sex is a main form of transmission for HIV. If you use meth, you shouldn't have to get HIV, right? There are ways to use meth where you're not going to have an increased risk of HIV transmission. If you're smoking weed, you shouldn't have negative impacts that are going to last the rest of your life. There are ways to do that. There are ways to inject drugs that are not going to result in abscesses or infections. Or HIV or hepatitis C transmission. So we're really focusing on what is it that we can do to reduce the harm with the way that anybody is going to live their life, and really try and push aside any notion of stigmatization or marginalization of any kind of drug use. Again, I don't care if you want to use meth all day, every day. What I care about is that you're going to be able to be as safe as possible while you're making the decisions that you make about your life, and you are the expert in your life. And to me, that's what harm reduction is. It's really about, and you can apply it to anything. You can apply it to the way that you consume food, right? Everybody likes cookies. If I eat too many cookies, I am going to get sick to my stomach, and over time, I'm going to put on unwanted body weight. That doesn't mean that I can't have cookies. It just means that I have to be really intentional and knowledgeable about the way that I'm eating cookies. And I use that as an example because cookies are not stigmatized, right? Meth is stigmatized. If we talk about, well, you can use less meth or you can use meth more safely, there's still that stigma underneath it that a lot of people are fighting, our clients included, right? We have folks that are coming in and they're like, what are you here for? And they tell us, well, I want to be abstinent. And you start to dig a little bit deeper into that. And it's really not about wanting to be abstinent. They don't want to wake up having done something that they didn't intend to do the night before. They don't want to run the risk of becoming HIV positive. They don't want to run the risk of falling out of medical care for HIV. So oftentimes, though folks might come in and they have an intention around being abstinent, what we find is that more times than not, that has to do with what is out there in the popular culture around the antidote to any kind of substance use. We teach and we get a million messages a day that says, if you're using drugs and alcohol, the only thing that you can do to solve those problems is to quit. And what we do is we recognize the fact that there are millions of people in this country that regularly use drugs and alcohol and are not having significant impairments on their quality of life. And so clean the slate and let's look at this about what is it that you're really trying to accomplish here. And I think in doing that, we open the doors to folks that, as Rio said, and I think Rio, you did a great job before. As Rio said, get turned away from other services and are underserved or have services that are not culturally aware enough to be able to serve in appropriate ways. And that happens all day, every day. And so what we try to do is the opposite of that.
Social workers often help people with diabetes, but how are you keeping up with it all? Do you know the current language and psychosocial approaches that actually decrease distress, the cultural considerations, and about all the medications, technology, and target numbers? The online self-paced Diabetes Essentials for Clinicians program is approved by NASW for 100 credits and is taught by interdisciplinary experts to improve your competency. Visit go.pacific.edu/diabetes essentials to get started.
Gotcha. Rio, I wanted to ask, how many clients are you serving? And I wanted to kind of get a cross section of the folks that you are actually helping. I mean, is it from all like rungs of like society? Is it a certain like class or race? Let us know.
Yeah, that's a great question. You know, every counselor and intern has sort of a different caseload, sort of depending on their unique needs and schedules. Probably between my individual and group clients, I would say that I serve probably between 5 and 15 clients in a given week. And I think one of the interesting things when you mentioned cross sections is we are trying at Stonewall to reach more and more people. One of the challenges I think that's happened during the pandemic in mental health, unfortunately, is that mental health challenges have increased dramatically and social isolation has increased dramatically. And so at Stonewall, we've recognized this and we've seen this. And during the pandemic, we've continued to operate services safely and remotely. And even as we are speaking now, we're making big advances in returning back to more in-person services for the clients that really need them. And talking about my own clients, I know that I serve clients that I have Spanish speaking clients. I have English speaking clients. I have clients who are older, younger. I have clients who are immigrants. I have a client who just recently came here several years ago, and I just find that a lot of the beauty in I think serving clients at Stonewall is there's not one type of client. We all of our clients do identify as gay, bi, or trans men, and at the same point within that there's so much diversity. And as we speak, we're continuing to try to increase the diversity of the clients that we serve, and we have many people who are seeking services, and we're getting people in to see counselors, and we're helping people move through the program and meet their goals. And so I think that's one of the really great things, being here at the Stonewall Project, is the opportunities to serve lots of different people. And as Kyle kind of mentioned earlier, every client kind of has there's a unique approach that has to be applied to each client, because every client is a different person and they know their experience in a way that nobody else does. And I think that when you look back at you know what being a social worker means, right, is helping people, meeting people where they're at, trying to practice ethical standards, try to really look at and be intentional about what the client needs, right? Using multidimensional assessment, using your clinical impressions. But I think at the end of the day is really that idea of just really listening to clients. And I think that when you listen to them, it doesn't matter they can come in with from any walk of life, but if you're there and you're empathetic and you're listening to them, I think that you can really be of service in some way. And so I think that that's sort of been my experience over the last 7 months here at the Stonewall Project.
Kyle, I was wondering if you want to add anything at all to that.
Oh yeah, for sure. We see folks, you know, we see folks ranging from high profile, high pressure jobs, living in the hills in the Castro, as well as folks that, slept on the sidewalk last night and haven't had anything to eat in 2 days. And every kind of circumstance and situation in between. Again, I'll just say, substance use and alcohol use in our culture in the United States is vast. And most people who are using drugs and alcohol are not seeking treatment, and are not homeless, are not, otherwise marginalized or disenfranchised or disempowered within our culture. I think one of the big differences from my perspective is issues related to access and to privacy. If I own my own home, I can use whatever substances I want in the safety of my home. If I'm without housing, if I can't go home because my parents have kicked me out because I'm gay, and I am basically taking shelter in the mass transit station, that is where I have to live my life. That is where I do everything associated with my life. And folks that are, lacking in privacy and other resources, are at higher risk of, exposure to enforcement mechanisms within our culture. And again, we all know that people use drugs. They use plenty of drugs in illicit drugs and prescription drugs and all kinds of ways that they're not supposed to be using it according to law. The people that are most endangered, as from a legal perspective, are those that cannot do so in private.
Yeah.
And so,
I
I'm sorry.
wanted to ask you also about stigma. I mean, there's been a lot more in the media now about addiction. There are shows like a Euphoria on HBO where addiction is out there. So are you seeing more awareness of it now, or is it really as badly stigmatized as it's always been?
I mean, this is anecdotal. I don't have data to back this up, but I would say it's as stigmatized as it's always been. Especially here in San Francisco, our mayor just declared a state of emergency in the Tenderloin neighborhood, which is basically where historically the city has fenced, folks with, that are going against the societal grain into, right? And so folks have been corralled into this area and then it gets over policed. And people just think of the Tenderloin as kind of this wasteland, and all the people that are living in it are disposable. They don't matter. And, stigma kills. It always has killed. It will always kill. And I think the way that we think about drug use in this country is inherently stigmatizing.
Hmm.
And it's as bad as it has ever been.
Yeah. So I'm wondering though, in the LGBTQ in that community, is there more awareness of it? Are folks who have an issue with it, are they more likely now at this point to seek help?
Rio, do you want to offer some thoughts here?
Sure. Yeah, I can jump in. Greg, I think that's a really important question, because I think a lot of when you're in the work and practice of trying to help people with their substance use goals, it's really important to reflect on, are more people seeking services, or are things kind of getting better? Uh, you know, I think in the same way that Kyle said, I think data about how that's happening now is I imagine very limited. I do think it's important to put this in the context of, we're in a pandemic, we're still in a pandemic, and that a lot of people have that rates of substance use increased dramatically in 2020. And if you look around and you walk around our offices, the Tenderloin is there. Yes, there's drug use there, but as Kyle said, there's also drug use everywhere in all walks of society, and oftentimes, you know, we don't see that, right? Or you're able to sort of see where people on the streets are using substances, but you're not seeing people who live in multi-million dollars houses that are using substances. So I can't say whether more people are seeking services. I certainly think that there is, there's more awareness in general, I think, about how we use substances. I know, like, just through looking at the communities that I belong to within the LGBT community, that there's more of an emphasis on helping people and taking care of people who've, maybe drunk too much alcohol, or that there's more uh, evolving consciousness on getting people help who are clearly, have had too many drinks or have had too many drugs. And I think that speaks a lot to the beauty of human beings, of helping one another and taking care of each other. And I think that is really really beautiful. But I think I would say that there's still a lot of work that needs to be done. As Kyle mentioned, the amount of stigmatization within our community around substances is alarming. And I think that the way that people view this problem is dehumanizing, because when we refer to, like, people using substances in all these different derogatory ways, it has an impact. And I think that, and it has an impact on how we actually, solve the problem, but it also really impacts the people who are using drugs, because it's like there's already a challenge with the particular substance, and then there's this crazy amount of stigma. And then, even the way that people talk about it. I mean, I hear people refer to people living on the streets who might be using drugs not even as human beings. And that, I think, always, brings me a lot of sadness to hear, because I think everyone in our community is a human being. Everyone in our community deserves the dignity to receive treatment and receive respect. And I think that while there may be some increasing levels of awareness, I really think we have a lot of work, a lot of good work to be done, but certainly a lot of work to be done to continue addressing these problems within our community.
Yeah, that's a very good point, Rio, that you said that there needs to be a lot more work done. A final question, like, for you is, in a ideal world, how should our lawmakers, how should our society um address this issue? Rio first, and after that, Kyle.
Gosh, that is $1 million question. I think, I think one thing that lawmakers would be really helpful. I mean, I'm very lucky to be part of an intern cohort where we have the resources within the foundation to train, substance use counselors who will be, the new generation of counselors and clinicians. And I think that that's a great thing. And I think there's such a great need. And I think that lawmakers investing in training new clinicians would be a great first step, because we have so many clients who need help. We have more clients than we on who are waiting to receive services than we have counselors, and that's just at our foundation. I mean, there's a lot of other community mental health centers that are just we work long hours every day trying to meet our clients where they're at, meeting their needs, and we want to take on more clients, but we don't always have the capacity. And so I think that, like, lawmakers, shifting the focus to really investing in quality substance use programs that prioritize harm reduction, I think is a great step. I mean, we're really lucky that the San Francisco Department of Public Health, has a very harm reduction focus, and that really allows us to serve more clients than if we were, just an abstinence-based program, because we would turn away a ton of clients that need help. So I think one is just investing in resources to train new clinicians. I think that having that would be a great first step. And oh gosh, I'm sure that there are other things, but that's sort of what's on my mind right now.
Yeah, I was wondering if you are thinking the same thing, Kyle.
I'm thinking about, our location as being in San Francisco. And of course, San Francisco is held up as this kind of liberal, sometimes lefty, place. So, I'm thinking about how much of this can be applied across the country as we're thinking about like, what do adequate and appropriate services look like for LGBTQ identified folks? And I think that's probably it's quite different in San Francisco than it might be from, Midland, Texas, for example. But I think we need to decriminalize drugs. I think we need to stop the war on drugs. I think that we need to stop marginalizing people who have issues of quality of life issues as a result of their drug and alcohol use. And I think that we just need to, start looking at people who use drugs, and have other situational and circumstantial positions that get stigmatized. We need to start seeing them as human beings and treat them with dignity and respect, the same as we would anybody else. We have a saying borrowed from Johann Hari, who has written extensively on harm reduction and the war on drugs, that the opposite of addiction is connection. The antidote to addiction is connection, right? And in this country, with the abstinence approach that we've historically taken, it's we tell people that are having difficulty around managing their substance and alcohol use that in order to access services, you have to abstain. Well, abstinence is not a realistic objective of somebody who, is living on the street and is using meth to stay up at night so that their stuff doesn't get stolen and suppress hunger. So what are the other alternatives to abstinence in that? And I think that if we can stop thinking that all drugs are inherently bad and all drug use is a moral failure, and start seeing people as human beings who deserve dignity and respect, that we will go a long way to resolving some of the broader societal issues that we have. And we haven't talked about overdose deaths here, but San Francisco had 700 overdose deaths in 2021. And that's according to the latest data. More people died of overdose deaths in San Francisco than did from COVID. And yet it's still treated as, we've recently got this public health emergency, but it's really taking a stance of like, we're going to round you up and we're going to get you off the streets and we're going to force you into treatment. And I do not believe that works for the majority of folks.
Yeah, thank you. Thank you. It's really been a pleasure. I've learned a lot, and I thank you for being our guest on Social Work Talks podcast, gentlemen.
You have been listening to NASW Social Work Talks, a production of the National Association of Social Workers. We encourage you to visit NASW's website for more information about our efforts to enhance the professional growth and development of our members, to create and maintain professional standards, and to advance sound social policies. You can learn more at www.socialworkers.org. And don't forget to subscribe to NASW Social Work Talks wherever you get your podcasts. Thanks again for joining us. We look forward to seeing you next episode.
This podcast was produced by Heartcast Media.